So we'll just wait. Great. So welcome everyone. Good morning. Welcome to our orientation webinar. And this is about the Best Practice Spotlight Organization program that's been designed for Ontario health teams. And we're really excited to have many of you join us. And because that indicates that you might be interested in joining our third cohort of Best Practice Spotlight Organization Ontario Health Teams, or BPSO OHT. So I wanted to start this morning by recognizing that the work that RNAO does with you takes place on traditional land and traditional Indigenous territories all across Ontario. And our office at RNAO is actually located on traditional and unceded territory under Treaty 13, which is the land of the Huron-Wendat, the Haudenosaunee, and the territory of the Mississaugas of the Credit. And this territory was subject to the Dish with One Spoon Wampum Belt Covenant, and that is about peacefully sharing and caring for all the resources around the Great Lakes. And we recognize and honor the fact that the land that we are working and living on, it includes people, First Nations, Inuit, and Métis people from all across Turtle Island. And we're really grateful to have the opportunity to work on this territory and land that dates back to over 10,000 years. So at RNAO, we are doing what we can to take our part in reconciliation and invite you to learn more about the land that you live and work on. And on the slide here, we've got a link to the native land, nativeland.ca, where it's a really beautiful map where you can learn a little bit more about the land that you work and reside on. So this is our agenda for today, and it's really in four main parts. I will provide us with an overview of the Best Practice Guidelines program and BPSO OHT program. And then Kristen will walk you through some of the deliverables for BPSO OHT. We're delighted that we have three members of our first two cohorts, cohort 1 and 2, who are going to share their experiences. So we have Fatima Ali, we have Melissa Sharp-Harrington, and Jason Bartel. And I see, Jason, I just saw your face on the screen. So welcome to our guest speakers, and I'm delighted to have you here with us. And then Steph is going to walk us through the next steps in our Q&A, and then we'll finish at around 10 o'clock. So this is your coaching team. If you do decide to join the program, my name is Susan McNeil, and I'm the Associate Director for Guideline Implementation and Knowledge Transfer, and I'm part of the coaching team. I'm one of the coaches. And then Kristen Campbell, say hello, Kristen. Kristen she's waving, but it's just unmuting. So that's Kristen. Kristen's part of our coaching team, one of the coaches. Steph Buchanan, Steph, I'm gonna ask you to unmute and say hello and wave.
Hello, everybody, welcome.
And so Steph is also one of the coaches, and Olivia Clay, who is our project coordinator and helps us with, does all the background work for BPSO OHT. So please say hello, Olivia.
Hi, everyone, welcome.
Great, thank you. So just in case you're not aware of who we are at RNAO, we are the professional association. So we're not the union, we're not the regulatory body, we're the professional association for registered nurses, nurse practitioners, and nursing students in Ontario. The key point, you may not be a nurse, the key point that we want to get across to you is that we work collaboratively across sectors, across roles to really advance best practices and promote excellence in clinical practice. So our organization actually has two main branches. One, we have a very powerful voice, and we have a policy program, health policy program at RNAO. And then the second pillar, that this program, the BPSO OHT program, is under our best practice guidelines program. And that really is a signature program of RNAO. And it really, what our vision is to transform care locally, across the nation, and globally, in fact. So this is our model of integrated best practice guideline model. And you'll see that there are three main pillars. So this guides the work that we do within our program and the BPSO program. So at the top, you see guideline development. And what we want you to know here is that the guidelines that you're using in the program are evidence-based, and they're rigorously developed. Bottom left pillar there is dissemination, implementation, and sustainability. So the key point there is we use multiple approaches, a multi-pronged approach to help you be successful at implementing and sustaining best practices, not just in your organization, but across your Ontario health team. And then the third bottom right pillar is all about monitoring and evaluation. So we have various approaches to support you to keep an eye on, are these guidelines actually being implemented, and what is the impact of them? So the Best Practice Spotlight Organization program, this has been around since 2003, so we're coming up to 20 years. And this is working with both academic organizations and healthcare organizations and teams like you in an OHT to work in collaboration to implement and evaluate multiple best practice guidelines. So what we're really looking at is practice excellence and making those positive impact, making a positive impact for clients, residents, people you work with, organizations, and health system, especially with OHT. So what we want to show you here is that the program, it's been around for just under 20 years, and we're global. You are part of a global BPSO network. So that means that you can tap into ideas, resources, innovations with others around the globe who are also really committed to making an impact. And you can also share your insights and resources with people in Jamaica or Spain or Qatar or China, across the globe. So just wanted you to know that this is part of a much larger program. I'm not going to go into detail here about the different models and types of BPSOs, but I just wanted to point out, you'll have access to these slides afterwards, but we have BPSO OHT is one of our models, and this is focused on integrated systems of care. And it is a 4-year pre-designate period that Kristen will explain that we work with you. And then after the 4 years, you continue to sustain and expand your work. We have this slide here because some of you might be still a bit foggy. What exactly is an Ontario Health Team? So an Ontario Health Team, these are groups of providers and organizations that are clinically and fiscally accountable for delivering that full coordinated continuum of care to a geographic population. So we want to work with you to help you be successful across all those different sectors: primary care, hospital care, mental health and addiction services, long-term care, home and community care, all of those different sectors. But we want to help you advance your goals as an Ontario Health Team. So this is how we kind of envision it. We've got the Ontario Health Team, and you have your goals as an Ontario Health Team. And then the BPSO OHT, Best Practice Spotlight Organization Program for Ontario Health Teams, is nested within that Ontario Health Team. And it really is designed to support that integration across those sectors. And so we're looking to work with you to make an impact at various levels. And we do that in two main ways. One is through evidence-based practice. the best practice guidelines. And the other is robust staff engagement. So those frontline champions who are working as teams across sectors, across roles to together implement guidelines and really make an impact. And the other thing I want to let you know is that our program, the deliverables that Kristen will talk about, are nicely aligned with all the building blocks, the 8 building blocks of Ontario Health Team. So this is where we're at now. We've already got 2 cohorts. The lighter colored organizations are those from the very first cohort. And we have 4 of those. And then the other 3 are from the second cohort. So we've got representatives speaking from both cohorts today. And then also we're really excited that we have a new BPSO who's just joined us. They're going to be the very first Indigenous focused BPSO called Mama Wasing OHT. So you will, if you join the program, you'll get to know them as well and learn from them and have knowledge exchange. So I think that's all I'm going to say right now. I'll pass things over to Kristen to walk you through the deliverables. And please put your notes in the chat box if you have them, or your questions. We'll focus on answering questions a little bit later on. So over to you, Kristen.
Great, thank you, Susan. Good morning, everyone. So as Susan mentioned, I'm going to walk us through the deliverables. There is a lot of information here, so don't be stressed. We will be sending out the recording as well as the slide deck, as Susan mentioned. So the BPSO OHT agreement outlines signed by the participating partners. Sorry, I just lost my thought there for a moment. Signed by the participating partners outlines what the BPSO OHT commits to collectively as one coordinated team and what RNAO supports. So by being part of the BPSO OHT, participating partners have entered into a 4-year collaborative partnership to provide consistent evidence-based practice across sectors to optimize care and outcomes. So there are 5 pillars that we focus on that form the foundation to attain BPSO OHT designation and support sustainability of the program. These include developing a supportive and sustainable infrastructure, building capacity within your organization, implementing multiple best practice guidelines, disseminating the processes and outcomes of the BPSO OHT activities, and evaluating the impacts on practice, patients, and the organization as a whole. These are organizational strategies that are based on implementation science, and I'll go into each of these pillars in a little bit more detail shortly. So after 4 years, OHTs become designates, yay, and the focus is to sustain, spread, and expand best practices and continue to engage staff in a robust way. Next slide, Susan. So this is the quadruple aim that many of you are likely familiar with. The BPSO OHT model is designed to help achieve the quadruple aim of improved patient experience, better outcomes, improved provider experience, and cost efficiency. This framework that you see represented here also incorporates the United Nations Sustainable Development Goals, and this is represented by the colorful outer circle, together with the quadruple aim addressing population health, supporting underserviced populations, and promoting health equity. So the BPSO OHT agreement reinforces that it's important to create your infrastructure. A strong infrastructure is critical to the sustainability of your BPSO OHT work. It involves individuals in key roles. For example, your BPSO OHT lead contact for RNAO, defined reporting relationships and an accountability structure to guide the work of the BPSO OHT lead and the implementation teams. So some key deliverables in relation to the infrastructure expectations include formation of a steering committee, the BPSO lead contact for RNAO, as I mentioned, BPG leads or co-leads, implementation and evaluation teams, and process that really enable and encourage communication between the BPSO OHT and the OHT Steering Committee. So here's just one example that we would share with you. What I really want to highlight here, as shown in this sample infrastructure, is that the BPSO OHT infrastructure should not be separate from the business of the organization. And the goal is to really integrate and connect with other committees or initiatives and align with the work of the OHT. Next slide, Susan. Capacity building and knowledge exchange. It is critical that education be provided to staff in all roles so that they can lead and support the practice changes resulting from BBG implementation. So these requirements ensure that the changes really stick because of knowledgeable and committed staff, and the structures and processes are in place to support the work. Interdisciplinary staff will participate in champions training from each of the participating organizations across the BPSO OHT. So it's important to note that this training will be done together for all champions, bringing staff from all sectors to begin working together. You will continue to engage additional healthcare providers and community members across all sectors, as Susan mentioned earlier. And by the end of the third year, you want to achieve a strong critical mass of champions, approximately 15%, to ensure sustainability of the program. Selected staff will participate as well in training and consultation of the nursing quality indicators for reporting and evaluation, NQUIRE, which is our data reporting system, as well as participation in knowledge exchange meetings and events, which will allow you to learn from each other, share your successes and challenges, problem solve, and a real opportunity to network, and of course, celebrate all the wins and successes. So during this 4-year pre-designation period, you will implement 4 best practice guidelines at each participating organization of the BPSO OHT. The 2 mandatory guidelines, and these were specifically chosen to align with the OHT quadruple aim. These include care transitions and person and family-centered care. The other 2 guidelines must be clinical guidelines selected to address a priority practice issue or that align with your OHT priority populations identified by BPSO OHT members. You will collaborate with the BPSO OHT and RNAO coaching team to plan for and monitor BPG implementation, participate in monthly knowledge exchange meetings to share key learnings and support cross-sector collaboration. An optional opportunity is to integrate applicable RNAO BPG order sets into your electronic health records or paper-based systems for those guidelines being implemented, and with coaching provided by the RNAO. And existing BPSO pre-designates or designates within the BPSO OHT provide mentorship to other organizations by sharing their experiences and strategies related to the planning, implementation, and evaluation and sustainability of the BPGs, the work that they've done already. Susan, next slide. So these are the 2 guidelines, as I mentioned, person and family-centered care and care transitions. And as I also mentioned, the other 2 clinical guidelines are selected according to organizational priorities. And an example for considerations that earlier cohorts have selected are engaging clients who use substances and preventing falls and reducing injuries from falls. All right, so we support champions and also formal leaders to combine 2 approaches to successfully implement and sustain the use of best practices. You will find these in the Leading Change Toolkit, which is a free online resource that RNAO provides. So this includes the Social Movement Action Framework, a grassroots, people-led approach that teams use to mobilize and accelerate change and engages people to make a bigger impact through individual and collective action. This is combined with the Knowledge to Action Framework. Many of you have likely seen this framework, which is your structured, systematic approach that guides you and your teams through all the essential phases of the change process to move and sustain evidence into practice. Dissemination. So BPSO OHTs share common outcomes of their work in a public way within the Ontario health system to inform the establishment of future BPSO OHTs. This deliverable contributes to capacity building within the BPSO OHTs, positions the BPSO OHT as a leader, and facilitates the expansion of clinical knowledge. This is achieved through a variety of different ways. Use of the BPSO OHT logo, you can see it at the lower part of the slide here, to support a visible presence and support a collective identity. Sharing BPSO outcomes with and between participating BPSO OHT organizations, as well as healthcare community members. This can be through conferences, events, presentations, or meetings like you're going to hear from our previous cohorts today. Sharing of resources developed on the RNAO website. Some organizations and OHTs develop a social media presence for the BPSO OHT on, leveraging Twitter or Facebook. And develop at least one collective manuscript within the 4-year pre-designate period. So the evaluation pillar, so participation, as I mentioned earlier, in the International Data System Nursing Quality Indicators for Reporting and Evaluation, so NQUIRE. Each participating organization within the BPSO OHT will be required to sign an NQUIRE data usage agreement and customized for the BPSO OHT. This is to allow for sharing of data across sites. BPSOs submit monthly data on a quarterly basis. Why evaluation monitoring? So monitor the adoption of new knowledge. How has the BPG implementation affected clinical practice? Evaluate the outcomes from implementing best practices. How has the BPG implementation changed patient and other related outcomes? Demonstrates value, engages and motivates staff. In addition, each BPSO is required to submit a My BPSO progress report twice a year, again, designed for BPSO OHTs. This is a qualitative report which captures information such as your capacity development, practice changes, your successes and challenges, and it provides a mechanism for your coach to help track your progress, focus your coaching efforts, and support that rapid learning and identify some impact stories. The Advanced Clinical Practice Fellowship, again, a program designed for Ontario health teams. This is a fabulous opportunity, and we're learning lots from the fellowship designed for BPSO OHTs. And you'll be able to participate in minimum 1 fellowship over 4 years. And I'm excited that you're going to hear more about the fellowship opportunity from from Fatima, who is part of our first cohort. Again, you'll support evaluation of the BPSO OHT program, conduct regular quality improvement monitoring activities, related to implementation of each of the best practice guidelines. So this is just an example of one of the reports that can be developed using data from NQUIRE. It's called an evidence booster. So the aim of this as evidence booster was to examine the changes in persons' participation and satisfaction in their planning of care and treatment when implementing the person and family-centered care guideline. This was from one of our Humber River Family Health team, who is part of Cohort 1 Northwest Toronto BPSO OHT. So lastly, just really want to emphasize that this is a partnership between RNAO and the BPSO OHT, and we are here to support you. So our commitment to the BPSO OHT is critical to your ability to meet the deliverables. This includes engagement of a BPSO coach, such as myself and Steph and Susan. Another key strategy that is embedded in the BPSO designation We support the BPSO OHT in the development of an action plan to collectively implement the required deliverables that I just reviewed, champions training and engagement. We provide consultation support through the RNAO BPSO team on guideline dissemination, implementation, uptake, and sustainability, as well as evaluation. We have a broader team that we also can tap into that supports with evaluation and some of the other deliverables. We meet virtually with the BPSO OHT as mutually agreed and or as necessary to review reports, monitor progress, and provide recommendations. As I mentioned earlier, we also host an annual BPSO Knowledge Exchange Symposium to support continued capacity development with other networking opportunities with other BPSOs within Ontario, nationally and internationally. So that was a really quick high-level overview of the key deliverables, and now I will turn it over to Steph.
Thank you, Kristen. So a lot of information, but as Susan mentioned, we do have the recording that we'll share with you and the slides that are available. But just as a little bit of a recap, Susan began by providing a high-level overview of the BPSO OHT program. Of course, Kristen spoke briefly about the deliverables of the program. And now you'll have a chance to hear from 3 people who are from cohorts 1 and 2. They've kindly agreed to share their journey and their lived experience as team members of the Northwestern Toronto BPSO OHT and the Chatham-Kent BPSO OHT. We'll just go to the next slide. I'd like to introduce Fatima Ali. Fatima is from Black Creek Community Centre. She's a research coordinator for the Northwestern Toronto ACPF OHT, lots of acronyms. Black Creek is one of the organizations that are part of the Northwestern Toronto BPSO OHT, and Northwestern Toronto is actually, fun fact, one of our first BPSO OHTs to join cohort 1. Fatima will be sharing her experience working as an advanced clinical practice, working with the Advanced Clinical Practice Fellowship and on it, and the dissemination activities Northwestern Toronto is currently engaged in that highlight how this work is benefiting the OHT as a whole. The title of her presentation today is called ACPF Quality Improvement Project, Understanding How Person and Family-Centered Care is Experienced within a COPD integrated care pathway. Now I'll pass it over to you, Fatima.
Good morning, everyone. I think it's the, oh, okay, perfect. So I've had the opportunity to be the research coordinator for the Northwestern Toronto's ACPF over the last year. And personally, it's been a great experience. It's been great having the opportunity, which I'll discuss further details in terms of what exactly we inquired about, but creating a research project and especially giving the opportunity to registered nurses to create a project and to conduct a methodology and speak to participants. The 2 project fellows that are nurses, Lelaine is from Black Creek Community Health Center and Sarah is from West Park Healthcare Center. And the 2 ACPF co-leads are Doris and Kim. Doris is from Black Creek and Kim Cook is from West Park Healthcare Center. So for the goal of our project is to determine the perception of patients with COPD related to person and family-centered care as they navigate the integrated care pathway and transition services within the Northwestern Toronto OHT. As you can see, like the guidelines that Susan and Christine introduced earlier, those are what we were specifically looking at. And the methods that we used include semi-structured interviews and focus groups. This project took place in the Northwestern Toronto OHT, but the 5 organizations that are specifically involved in this project include Black Creek Community Health Center, Humber River Family Health Team, West Park Healthcare Center, Runnymede Healthcare Center, as well as Humber River Hospital. The results are, the aim is to understand how patients, caregivers, and healthcare providers experience person-family-centered care and care transitions. the two research questions that we have are, what are the experiences of persons with COPD whom access services for COPD and are placed on an integrated collaborative care pathway in the Northwestern Toronto OHT? The second question we had is, how do persons with COPD experience person and family-centered care in their care journey across an integrated collaborative care pathway for the COPD within the Northwestern Toronto OHT? So these are the two questions we started with, and then we worked as a team to create a methodology on how to understand what's actually going on. So we did semi-structured interviews with participants with COPD, and we did it at three different times. Initially, when they were recruited to the project, at transition, a minimum 3, but hopefully more. Whenever they transitioned, we did another interview, and then we had a final interview. This was done with participants with COPD as well as their caregiver, and we did healthcare provider interviews at the transition points. And then the second methodology that we are using is focus groups, and this is done with the participants with COPD as well as the caregivers. And now we're at the stage of doing data collection and data analysis. So it's interesting seeing how the findings are speaking to those original questions that we had. For the communication strategy, we developed 3 different types. We did verbal communication, which included presentations, something similar to what I'm doing today. We also have communication items. We created masks, buttons, and pens, and we also created a logo, which was a very fun activity with the working group to represent our project. And the goal of all of these communication strategies is to increase visibility of the ACPF project and the BPSO guidelines and all the hard work the fellows are doing. And the last form of communication that we did include is e-materials. We created a project summary that has all the details of the project, so recruitment strategy, methodology, and then we also did a newsletter, and this is sent monthly to all the stakeholders that are associated with the project, and it has key information about the project. It's a smaller document that you can see on the screen, the main purpose is to provide updates and to show people how we're progressing along the timeline, so to keep everybody in the loop. So these are the 3 types of communication that we've been using for our ACPF project. Thank you everyone for listening.
I just wanted to add, Fatima, that your communication strategies, you're a great resource person for those who join cohort 3 if they wanted to reach out to Fatima to say, how do you create an infographic like that? What do you do? And she can give you steer you in the right direction. So that's the part of it. That's sort of one of the approaches that you can learn from what others have done and borrow their ideas. Thank you so much.
Thank you for having me.
So I think we'll go to the next slide. Thank you so much, Fatima, for sharing your experience and working with the ACPF. And now I would like to introduce Melissa Sharp-Harrigan and Jason Bartel, who are from the Chatham-Kent BPSO OHT. Chatham-Kent is part of the second BPSO OHT cohort. Melissa is the Executive Transformation Lead of the Chatham-Kent OHT, and Jason is the co-chair of the BPSO Working Group. They've kindly agreed to share their great work, the great work that they've done organizing and promoting the BPSO OHT activities by using social media platforms such as Twitter. I'll hand it over to you, Jason and Melissa.
Great, thank you so much, Steph. And thanks for having us today to talk about our work with BPSO as an OHT. So as was mentioned, the Chatham-Kent OHT was one of the second cohorts. And when we made the decision to become an OHT, we really had very few organizations that had experience as a BPSO who were already accredited as individual BPSO organizations. So I'm sure, like some of the people on the webinar, we had a lot to learn as a collective about what the BPSO was and what the accreditation would be. That said, we had a very high percentage of our members sign on as individual organizations. I think the total signatories capture about 14 of our 17. So we really began by leveraging the first champion training as an opportunity to spread and scale. And you can move to the next slide, Steph. So at that championship training, you have the option, you can send as many people as you'd like to the training. Some of the other OHTs had a handful of people, and at our OHT, we had 56 participants who participated across those 4 sessions. And we did that intentionally because that championship training really allowed for us to have not just the leaders and the OHT decision makers become involved in the work of our BPSO OHT accreditation, but frontline leaders and individual leaders, cultural leaders across all of our organizations really get an understanding of what that was. And that was very successful in building our capacity as an OHT to understand the requirements of BPSO, but also to prepare us for some of the work ahead. So as Jason will talk about some of the work of the working group, I would say as an OHT, the broad participation in this championship training, which included physicians and some of our patient and family advisors, really allowed us to set that groundwork in the work that we're doing. And in terms of social media, what we did throughout the training itself is we really made sure that we were tweeting out. We encouraged people to tweet out. There was certainly some encouragement from the RNAO for sharing on social media, but that really helped to get the conversation going and helped us to marry our OHT brand with the BPSO brand. So on the next slide, it really just captures how we've structured our working groups. This is reflective of the larger governance structure within our OHT. So our OHT is an intentionally smaller OHT in terms of partnership. We have one collaboration steering committee. All of our OHT partner CEOs or executive directors sit on that collaboration steering committee. And there are 7 working groups of that OHT that report into the steering committee. And our BPSO working group is one of those 7 working groups. And so the reason we have that structure is so that we can make sure that the steering committee is very much aware of everything, and there's only one step between our main governance decisions and the work of the working groups. All of our working groups have task teams that will take actions away and come back to those working groups, of course, but that's our structure. And what I'm going to do is turn it over to Jason Bartel, who is one of the co-chairs of the working group, to share some of their experience. But what I will say first before we do that is as an OHT, all of our working groups are co-chaired. And in this case, it worked out really, really well because our other co-chair, Meredith Whitehead, is the chief nursing officer at the hospital. So we have a co-chair who is in a hospital, one of our larger acute care partners. And then we also have a co-chair who's in primary care, one of our community-based and primary care partners. So that combination worked out really, really well for us. So Jason, I'll pass it over to you to share some of our successes.
Thanks, Melissa. So our BPSO working group really formed and took place after our champions training. And so when we initially started to meet, we started looking at basically 2 pieces. One, our initial gap analysis for patient and family-centered care, which we then used to lead into our launch. Some of the initial work we did was really determining what patient and family-centered care meant to us. And you can see to the right of the slide here, a word bubble that was done by the working group of keywords that we felt that really resembled what we were trying to do with the patient and family-centered care guideline. And we also have worked in while developing this along with our PFAC to develop a initiative there with them to understand that, make sure the patient voice is always there. And we do have a PFAC member that sits on our working group. So next slide. So then our next big project, which did get pushed a couple times because of COVID, unfortunately, but did happen in March, was launching our BPSO more widely. So we used an approach of together but apart. So we came up with a standardized launch presentation with some testimonial videos, reflective questions, and a very structured method that we sent to all the organization BPSO leads to host within their organization in different ways over the course of a week to engage their organization in the official launch of the work that we're going to be doing over the next year. We saw organizations that held multiple staff meetings. We had people that creatively had to record their presentation and send it out to staff just because of scheduling. And we used different ways. And then there was also a standardized social media launch package that was pushed out by our engagement person with the OHT, Tiffany, and then also matched with a lot of the organizations on their social media, sharing little snippets and additional information about our BPSO launch. Next slide. So now that we've launched, we're now starting our work into looking at how we're going to monitor and implement the required recommendations. And so we're looking at how we're going to progress report and work on our common goals across the organization. that's kind of my piece. Thanks, everybody.
Thank you so much, Jason. Does anyone have any questions for Jason and Melissa?
Can I ask a question? I'm just wondering.
Has a question.
Well, if people need some warming up, but Jason or Melissa, you had a really great turnout for the champions training and super high engagement. So do you have any tips on like selecting champions or getting people interested? Because we talk about robust staff engagement being really, one of the approaches that we use in this program to mobilize change. So if those in cohort 3 are starting to think, well, who would we get involved? Do you have any tips? And Fatima, you might chime in as well, but any tips for others about that?
Yeah, thanks, Susan. I can start and then Jason, feel free to chime in. I would say, and some of the cohort 3 or potential cohort 3 OHTs may be in a similar spot. So as an OHT at the steering committee level, we were talking about some of those OHT deliverables, our patient and family centered our patient and family engagement strategy, how we were going to sign off on our patient and family declaration of values, which were ministry requirements as part of our TPA. So our steering committee was having those conversations. And as we were talking about those deliverables at the governance level, we were also talking about the requirements for BPSO. And so we did have commitment and we did really encourage our steering committee members to give their staff permission to attend the champion training, to make time in their schedules, and to bring forward a diversity of individuals. So if physicians could attend, we wanted that. If patients could attend, we wanted that. And we really wanted to make sure that each organization didn't just have one champion, but had 2 or 3 champions based on their organization size. And as many, our hospital has a much larger organization, right? So they put forward more individuals. And I would say the champion training itself made it easy for people to come back. It was fun, it was engaging, there was lots of diverse speakers, especially given the timing in Zoom. I think everybody's tired of the virtual, but the RNAO made it easy to participate. And then the other element I would say is just thinking about OHTs and the purpose of OHTs, right? We really sent home that message of we need to change how we do things from a patient and family-centered care perspective. We need to make patient and family-centered care the absolute focus of all of the work that we're doing. And this best practice, the BPSO accreditation, allows us to be able to confidently say that we are making progress towards doing that. So that was something that was really encouraged from the top. And I think that had that really influenced the larger number of participants who were in that champion training.
Thank you.
I was gonna say the one other piece I think was the interdisciplinary part is so, you weren't looking just to pull your nurses or just pull your secretaries, where if you could find a couple different people across organizations, it really helped leaders kind of engage there. And I think also just timing, and I think, for cohort 3, so when we did our training was kind of in between waves of COVID, right? And so people were looking to do something that wasn't COVID, and we capitalized on bringing people in to a different process in that. And so I think, looking as we're hopefully going out of another wave of COVID and that, maybe a way of just engaging back in a different part of healthcare that's not directly COVID related, and it just brings that interest to the table.
Thank you for that. Thank you so much to Fatima, Melissa, and Jason for sharing your great examples of the BPSO OHT activities and how the work has benefited your OHT, and in particular with your responses, Melissa and Jason, just really showing how using the key pillars that are within the RNAO deliverables like infrastructure and dissemination actually helped to move your work forward, accelerate your goals, your OHT goals. So we shared a lot of information with you for your consideration. So now we'd like to talk about next steps. If we can flip to the next slide, please, Susan.
Yes, there's just a question in
is there?
in the chat box. So Cheryl is interested in understanding What dedicated resources are required to ensure success of your BPSO OHT deliverables?
Yeah, so I can start from the OHT perspective. With resources, our engagement and partnership specialist, so she's a full-time dedicated FTE within our OHT core staff. She owns the portfolio for the BPSO. That's one of, I would say, 5 or 6 major portfolios that she has doing the work of the OHT. And so it's not a full-time dedicated resource on our part. I would say it's probably about a day a week, maybe a little bit less, just depending on what it is that we're doing. But that being said, for your BPSO to be successful, it's not just an OHT resource. Each participating organization has to be willing to put in the time and resources to do some of the work. So one example, and this is just a small example, as an OHT, we're talking about who has patient and family advisory committees or something similar to that. And we're looking at the potential interest of maybe launching a network for patient and family advisors. So each of our participating organizations had to go back, look at if they have any PFAC resources, look at any terms of preference, and be prepared to bring that to our meeting, right, as homework to come back. So there is a lot of takeaways and a lot of homework that each individual within those organizations have to do between meetings. So it's not, it's not just a single OHT resource. It's certainly a shared resource across many partner organizations.
Thank you, Melissa. I have a question specifically for Fatima. I wonder if you might have any additional tips for anybody, not to put you on the spot, Fatima, but any additional tips for folks that may be thinking about, I know there's a lot of information, but specifically about about ACPF, the Advanced Clinical Practice Fellowship, and how that work has helped accelerate the OHT goals.
I think the ACPF project is like an active, it's a very active role in terms of doing the work, in terms of progressing the pillars, where our project was connected to a lot of different organizations within our OHT, and that further encourage those connections and those relationships. And we had people from, we not only had nurses a part of those, like the working group for our ACPF project, but we had people from admin, we had a patient family advisor. So all of the collaboration with everybody sitting at the same table and actively thinking about patient family centered care pathways. And now when we have the product that's created, the guidelines or the paper or the results, we're going to be able to share that with even more people. So I think it's that active piece of it that was very useful, and I think very useful for everybody involved in the project.
Thank you so much, Fatima.
I just wanted to add about the ACPF. I put it in the chat, but it is a funded opportunity. So it's $15,000 to support that integration. So it's a little bit extra that helps to enable that to happen.
Thank you, Susan. Are there any other last questions before we move on to next steps? Okay, there'll be a little bit more opportunity. We've got about 10 minutes left, so there'll be a little bit more opportunity to ask further questions if you have any. So as I was mentioning before, we've shared quite a bit of information in this 50 minutes. So now we'd like to talk a little bit about next steps, which includes some key dates for you to take note of. If you're excited about what you've heard so far today and would like to become a BPSO OHT and part of the 3rd cohort, please submit your letter of intent, and it can be done through the RNAO website, and we can share that link with you in the chat as well so that you can kind of open it and bookmark it. So a little bit over, in a little bit of over a month's time. In terms of the BPSO OHTs being selected, that will be done over the months of June and July. So the OHTs will be selected and the agreement signed in June and July. The excitement really begins when we have our virtual launch in September. So once the agreements are signed, the OHTs are selected, we'll have a BPSO OHT launch in in September, which is actually fast approaching. It sounds far away, but it's actually just around the corner. So those are some next steps for you to consider. We'll flip to the next slide and we'll give everyone a bit of a last opportunity to ask any questions.
I also invite Melissa or Jason or Fatima, if you have any other tips that you thought of, oh, I should have said this, or anything that you want to reinforce that any of us have said today about deliverables or about the program, or tips about getting involved, anything like that. I'll open it up for your final tips as well as questions.
Susan, I can just go maybe in closing to share that, the work to get accredited is significant for the OHT to do. But as I was saying to Susan and Kristen just before the beginning of the webinar, it is incredibly valuable as an OHT to have access to those resources and repositories. As we're doing our co-design for other areas of care, we've already started to talk about, have we integrated the best practice guideline into our palliative care conversations, into our COPD conversations? And so that's something that you don't really think about as you're deciding whether or not you're going to go through the accreditation. You're thinking about, year 1, year 2, year 3, year 4. But already at the halfway through year 1 point, we're starting to see how we can integrate the lessons we're learning from our accreditation into other areas of our OHT. So I think that's something that we've seen as early value through participating in the BPSO accreditation as an OHT.
Melissa, just a question I had too, or any, Fatima, Jason, did you find that this, and you may have commented on this, that this work actually helped foster and bring the Ontario Health Team together, like those partner organizations, in a different way that you may not have before?
Yeah, so I would say that because the focus of the BPSO is more patient family centered, and it starts kind of more like with the patient family centered care BPG, but moving on towards more clinical processes, it really does allow staff members of your partner organizations who are frontline, who are delivering care, to become meaningfully connected to the OHT. And so I think that's part of also a general development of OHTs, right? It starts to be very planning and high level. And then as you mature, it starts to become more patient focused and you start to talk about patient pathways. And the work that we're doing through the BPSO OHT accreditation certainly is in line with that, right? It's bringing in people who are frontline into the work of the OHT and helping them become more connected to it.
Great, thank you.
I don't see any other questions in the chat.
Okay, yes, I'm not seeing any other questions either, and I'm not seeing any hands up. So maybe what we'll do is leave you with Olivia, and maybe you can put your email, Olivia, in the chat box as well. So if you have other questions, Olivia is going to be your point person. And as the project coordinator of BPSO OHT, we expect that you will have more questions as you think about the presentation today or look at the slides, and we are more than happy to help you with that. So I think what we'll do now is thank our guests so very much, Fatima Ali, Jason Bartel, and Melissa Sharp-Harrigan, for bringing your experience of what it's like to be in the program in the first and second cohort. And then thank all of you for taking the time. We are so happy to see that there were many of you, over 20 of you, who are considering, well, maybe we'll join cohort 3. And so we really hope that you do. And we're happy to, we're there to support you. And and tailor the program to your particular OHT in appropriate ways, and support you along the journey so that you're working towards meeting your goals. So we certainly hope that you join us and invite you to reach out to us if you have any questions. And just thank you so much for taking the time this morning. So we hope this got you started and on your way. So good. Yeah. Thank you everyone so much.
Thank you.